Thanks for having me today on the podcast, Jeff. So I'm a psychiatrist, Dr. Jacques Jospitre. I have a background in business and technology. Basically, after residency, I came out with an MD MBA in a hospital for 4 years, ran a clinic for three, and then that's what got me into starting my own business, which is SohoMD. We do functional medicine and psychiatry at scale. So basically, we offer people psychiatry, but we found a way to make it better by looking at nutrition and endocrinology in addition to standard psychiatric approaches. And so we're able to give patients great outcomes while keeping it affordable for them.
Oh, that's awesome. Yeah. So let's maybe go back a little bit more. I mean, let's talk more about maybe that origin story, how you got into it, maybe what some of that, some of that background and what kind of inspired you to take this on.
Yeah, in terms of psychiatry, so like I was always interested in, what made people, their best selves, like
Hmm.
how could you achieve it? What was the gap between what you wanted to do and where you were in life? And so that was part of what, inspired me. I think all of it also it might have been tied into the fact that both my parents are psychiatrists. So
Okay.
it's just kind of a family profession, but,
Hmm.
that was one of the reasons I didn't wanna go into it. I'm like, "Oh my god, my parents are psychiatrists, I'm not interested in it," but as I learned more, as I grew and I understood really what the job was, it really spoke to me in terms of my interest in helping people. That was always kind of part of who I was, and so, as I went through my training, just seeing how to put all the pieces together and seeing psychiatry as really the software of medicine, where you're really looking at ways to enhance a person's performance and helping them achieve that. That part of the field is what got me excited about getting into it.
Yeah. So let's talk a little bit about what is the problem that Soho MD is really solving. I mean, what did you see and go, hey, I'm going to address this with my background.
Yeah, as I said, I was in a hospital. I was the head of a psychiatry department, oversaw the whole department in terms of all the operations, treating people there, and I thought, okay, there's a difference between the way psychiatry should be practiced and the way I thought it was being practiced there. And the same thing happened at this clinic, and I thought, hey, I could do a better job. And then once I started this company and I was, treating thousands of patients, there was a gap between like how patients were doing, even though we were following the best practices, we're doing the best quality care by following the American Psychiatric Association guidelines. So we're doing everything you're supposed to according to the books. But
Hmm.
there were all these patients who weren't getting better, and so that got me and got the team interested in exploring, what were we missing? Why isn't this working? And that's what led into exploring integrative health and functional medicine to find what is the root cause of psychiatric symptoms. Meaning that have a psychiatric symptom, it's not just something that you need in SSRI, you need an SRI, all these medications that we have in psychiatry, they address the symptoms that you're experiencing, but they address the root cause. And the work of integrative health and functional medicine gets to the root cause, where the psychiatric symptom is simply one facet of the problem. And so we went from just treating symptoms to really getting to the root cause of those symptoms. And we saw patients who were thought to be resistant to care truly getting better by taking that approach to treatment.
So, what would be the IP here that we're discussing right now? Is it just a formula, something that you've put together, an app, just a medical practice per
Yeah,
se?
yeah,
Like, what
yeah.
is the IP that we're
So
looking
so
at?
the intellectual property is really the clinical model. So how we think about the cases, how we approach it. We've spent 14 years doing this, so we really have a way of dealing with psychiatric cases in this much more robust way at scale. So it's covered by people's insurance, it's affordable, it has great efficacy in terms of patients getting better. Now what we see in terms of, our raise, like we're raising money for the first time, we've been self-funded till now. It's really to take AI, to take our data set to train an AI system to create something called a CDS tool, a clinical decision support tool, to focus on helping clinicians who are not trained in integrative health and functional medicine to help them do this high quality version of psychiatry. So we have the ability we have a lead in terms of what we would do to train that system. And so we would protect that new software solution once we've developed it.
Just so I'm clear, because I'm kind of diving in here as well for a little bit. So, is this something that a person from home would jump in and use, or would it be something that having doctors be trained on the way you're doing it, and then they're administering the medical practice? I
Yeah,
guess
yeah,
at that point.
it's a great question. So this tool initially would be used by our clinicians. So a
Hmm.
clinician would be hired, they would use this tool. It would help them make the right decisions in terms of, all the different choices and options they have for a patient. So the patient wouldn't see it, they wouldn't experience it. The clinician is using it and able to leverage it. So initially, it would be used internally, but eventually we see it being a tool that a primary care doctor could use. So
Gotcha.
80% of psych meds are actually written by primary care docs and not by psychiatrists or psych NPs. So we would have this be the collaborative care tool that they could use, where they could upload the labs, they could upload charts, and it would give them a treatment plan that was according to this functional medicine approach to care, where they could get great outcomes for their patients.
How would the HIPAA laws work around this? Do you have to really share actual details of the person's information, or are you just sharing it like, hey, these are, I don't really need a name, first name, last name.
Yeah.
Here's just what they're here's what they're dealing with. Here's what we think would make the most sense. Would it be something like that?
Another great question. When you talk about like a training system, so you can have an anonymized data where you've taken out any specific details about a particular case. So it's just a general information. When it comes to processing, is having something that's doing the analysis, you can develop a system that's enclosed in such a way that that information is not it's not getting extracted, it's not being transported anywhere. It can be contained within a certain specific module, so that because the issue of HIPAA really has to do with the release or sharing of protected health information. So both the analysis of training the model and the person who's using the model at the end, both of those could be done in a way where we're not violating any regulations like HIPAA.
Right, right. Interesting. What is sort of do you have a persona in mind of the type of clinician that would be open minded to this? Is it somebody that is like always struggling with something, younger, older? Do you have to sort of I guess a buyer persona to some, or a user persona in your
Yeah,
mind
I
right
think
now?
yeah, in terms of the clinician, I think the clinician who cares about their patient, right? So when you're a clinician, you go to medical school, you go through residency, you spend years of your life because you want to be a person who can help patients get better. So when you find a resource, you find a tool, you find anything that has those outcomes for your patients, you're going to use it. Doctors are overloaded with information, right? Textbooks, research articles. There's a constant flood of new information that's coming out that you need to incorporate into the work that you do. Like, can you keep up and read all the literature about everything going on in your field? And it's very difficult to do that and treat all the patients. And there are more patients than providers right now, right? So we have a system that can take all those best practices and distill it and put it at your fingertips. Some clinicians and I think they're rare, who may not be interested in doing what's best or doing what's new. This clinician who only wants to do what they've always done. This is the way I've done it. I don't want to change. That clinician, that's may not be the right clinician. But I think that that's the exception, not the rule. Most clinicians want to do great work. They want to be a great clinician. They want patients to have great outcomes. I think the majority of clinicians, given who they are looking for these solutions and would gravitate towards this offering.
What would be some of the potential objections or pushbacks from somebody saying, I don't need another tool in my toolbox, right? Like, what have you, maybe have you heard anything behind the scenes, and how do you address those?
And the example I think of when it comes to like technology and medicine have not gone well, right? Like, I mean, medicine has fought tooth and nail as far as adopting EMRs. Like, it had to be forced into the industry, right? And
Right.
I look at the example of like the iPhone, right? When it came to people, dropping CDs, dropping albums, and saying, "Hey, I'm going to adopt this technology to store all my music." Like, people were enforced to give up their CDs or cassettes or records, right? They did it because the experience was so great on the iPhone, on the iPod, actually before the iPhone, but it was so
Mm-hmm.
great on the iPod. People were like, "This is awesome. This is such a wonderful experience. I want this." So the experience of using these tools, you've got to decrease the administrative friction, meaning all the nonsense that doctors have to do in terms of seeing patients, looking things up, documenting it, all this stuff that we have to do that go outside of just the general clinical engagement. When you create a tool that makes that experience wonderful, where the clinician has all the information they need. The usability is incredibly high, so you don't have to go through a manual. You don't have to go through a training. It's intuitive on how to use it. When you have that experience and you help the clinician make the right choice, that combination of usability plus great information support, great intelligence, that combination is going to compel all clinicians to want to use this tool either from us or from someone else, but that's inevitable. Like we all want that. The point is no one's created it yet, and that's where the opportunity exists.
Hmm. Would patients be aware that this is even happening behind the scenes, or would they not really be aware of the tool being used?
They don't have to be. What patients will be aware of is that their doctor seems a lot better than other doctors.
Hmm.
Like, the doctor picked the right medication from the get-go. The doctor made the right recommendations in terms of diet and supplements. They had fewer side effects. They got better a lot faster than other people they know. So that
Hmm.
patients hint that something's going on. Like, why is this so much better? Because the outcome, the clinical experience is just much better. That will be the first indication that there's something else going on. But I think there are other parts of this, like where it ties into like other collectibles, like data that collects information, like wearable technology, like the Apple Watch and other kits and other tools where patients will be able to integrate their consumer products that collect health data. They'll be able to integrate it into the platform. I think those will also be another indication that, hey, I have a tool that can absorb all this information from all my different devices that are relevant to my health and kind of incorporate it and feed it back to me. I think that'll be another indication. But over time, at some point in the distant future, patients would be able to engage directly with this tool. But I think
Hmm.
next, 5+ years, I think we'll keep it on the clinician side.
Gotcha, gotcha. And let's talk a little bit about what are the revenue streams that you are seeing right now, and predicting in the future as you grow and stuff.
The revenue stream really focuses around clinical work. So we're talking about a tool that helps a clinician see more patients, do a more thorough job, and just have great, high quality clinical quality, which is valuable to the patient, the clinician, and to the insurance companies. So I think that that's where we focus on monetizing it, is simply making sure that we just help clinicians do a better job,
Gotcha,
and scale up a business that accomplishes that. Later on, we can talk about being able to offer the software as a service, and then we can monetize it that way, where the software is directly being offered and used that way. But initially, it's just purely through services.
gotcha. So the clinicians are hiring. I guess you guys are paying a monthly fee. How does the clinicians access this? Yeah. So if I'm investing right now, what am I thinking about? Like, oh yeah, I see where the revenue streams are going to be.
Clinicians are leveraging this platform to treat their patients,
Okay.
and they will have better clinical outcomes for their patients. Their work will be a lot easier using this platform than other platforms. So
Hmm.
they make more money and they're doing better clinical work and doing less administrative work. That's where people would benefit. So the business would get more clinicians on this platform than other ones. So we would have
Okay.
experience that clinicians will say, "Hey, I want to work on the SohoMD platform to see my patients versus these other competing platforms."
Gotcha. So is what does competition then look like? How do you speak about that? Maybe around, is it other telehealth platforms? Then is it just other types of medication, other types of different maybe formulas, or how somebody might come together to treat a patient? What is competition in your world?
Yeah, and the competition are other telehealth platforms that aren't doing functional medicine. They're not thinking about these solutions. A lot of what they do, like they're incorporating AI, but what they're optimizing with AI is different than what we're optimizing.
Okay.
Because of our clinical work, we have an advantage in terms of creating a system that will get the efficacy and efficiency that I'm talking about based on how we approach psychiatry. So we'll be competing with other practices that are really focusing on conventional psychiatry, while we have this different version of psychiatry that we're optimizing.
Gotcha, gotcha. So let's talk a little bit about, where does WeFunder sort of fit into this? What are some of the conversations beforehand? Why are you thinking, hey, I'm going to go to this as a potential place to raise some capital?
Yeah, so definitely we've spoken to investors. We're still in conversations with VCs and with PE funds. So those are ongoing conversations, and those are moving along. But what's special about WeFunder is WeFunder allows us to connect to an audience of people who care about clinical quality. They understand the challenges of behavioral health. They understand that there really is a need for a
Hmm.
transformation of the field, and they want to support that effort. I think a lot of the conversations with conventional investors, they're looking at conventional metrics, right? They're saying, hey, we have other behavioral health investments, or we've seen other behavioral health companies, and they're trying to compare us and put us in the same light as other behavioral health companies. but we're really
Hmm.
something unique and different that the other companies aren't. And I think the WeFunder, the crowdfunding investor gets the narrative. They understand, especially for people who've needed real treatment and have had challenges
Hmm.
getting that treatment and understand the power of functional medicine. They're the ones who are really they're really incentivized, and they're really they understand that mission, and they buy into the mission, and they're willing to really get behind what we're doing. And so it's been great to have them to kind of really help jumpstart this effort around fundraising. But we do have ongoing conversations with the other investors. The other investors will join at some point, but it'll take a little bit of time, I think, for them to fully grasp just the
Sure.
value proposition that we have on the table.
And what does sort of use of funds look like right now? Is it more development in tech, marketing, getting more clinicians to use it? What does the use of funds look like right now?
Yeah, the use of funds is really around the tech, getting the platform done in such a way that we can really get a lot more providers leveraging it, and an expansion of the platform.
Hmm.
So that's really so getting a lot more providers who are using this version of SohoMD.
Yeah. Where are you right now in the tech development side? Because it seems like it could be a fairly heavy lift, just to get all that tech side of it built. So where are you right now in the development of that?
No, it's actually what's interesting is, with AI, there's a lot that is offered now, as
Hmm.
far as like you have AWS where you can go out there and you don't have to have a server farm, you don't have to have people managing your database server and any of those things
Hmm.
anymore. You just spin up a server on AWS and you're good to go. So the same thing's happening in AI. So when you want to develop an AI system, the whole AI software, the whole stack can be leased basically. You don't have to develop
Right.
it. You can focus your work on the data. So what's the training data that you're putting in the system? And you can do it in such a way that you can maintain the IP afterwards so that
Oh,
you can
interesting.
build it. You don't have to do it from scratch. So it's possible to get something up and running within a few months. So it's not
Oh, interesting.
years of, getting developers and building things from scratch. It's really understanding what you want to execute on and being able to put it into place and put it into practice.
Where does it fit into that narrative that you were just talking about the quickness of turning up, of getting, making sure it's, the usability is good, that people can, they're adapting to it, they're understanding it, they feel like they're getting fulfilled out of it. Like, where does that start to come in from? Yeah, we cookie cuttered and got one up there. We got it, we got the idea up, but now we really want to make sure people are using it.
Yeah.
Where do you sort of fit into that and thinking about how somebody would really use the system and get the most out of it?
Yeah, it starts with, well, the first thing is working with partners. So really focusing on the usability. So again, we're not focusing on the nuts and bolts of the different pieces. We're focusing on how do we stitch it together? How do we put all the pieces together and then make it as easy and intuitive as possible for the user, who is the provider, to get in here, for the system to present meaningful information to them and make their lives easier, and leveraging AI in many different aspects of that process, that workflow. So the key is that we're not starting from scratch. We're not building an EMR from scratch. We're not building the AI
Hmm.
from scratch. We're leveraging tools that are open, have open APIs, and that have complete flexibility. So we're able to build something where we're able to put our perspective, our version of psychiatry. We can build it out using tools so we can get to market very rapidly without a massive raise, and then deploy something that we expect that providers will be delighted to be on this platform versus the other platforms that exist.
Yeah. How are you measuring KPIs right now? Is it clinicians that are onboarded? Is it patients being used? What are some of the metrics that you're looking at right now that is showing growth
Yeah,
in the
yeah. I
pitch
mean,
decks?
yeah. Historically, it's looking at providers on the platform, how long they're staying, looking at how many visits the patients have. Those have been the key metrics for us as we really develop and deploy this new version, this new clinical experience, and automating it with the technology. We'd be looking at clinical outcomes. So how quickly people respond to treatment, just how much can we decrease the claims. So for people who are at risk of having other costly medical treatments, comorbidities that tie into their mental health, how can we take patients, for example, with migraines? How do we combine our approach to care plus these other, like another migraine treatment from a company like Jago Health, which we have a partnership that we're launching with them. So how can we take this approach to care to decrease the migraine experiences, migraine days for patients? So looking at broader clinical outcomes, looking at the overall health of the patient, looking at the overall expenditures related to managing that life for us to track what it is historically, and then what we're able to do with our approach to psychiatry. Those are the KPIs that we care most about. And I think those are the ones that will allow us to really partner with the insurance companies, where we go back to them and say, hey, here are some real savings that we're able to offer you because of how we're approaching care. And that's what will help us really expand and grow very quickly.
What's keeping you up at night just around the company, the raise, everything? What's the biggest thing that you know you gotta got it the
Yeah.
biggest hurdle where
Yeah.
you got to jump over?
Yeah, I think the biggest one is AI. So AI is moving at such a fast rate that either you're in it or you're not. And I think everyone's using it. It's overused. It's like
Mm,
overhyped. Everyone's slapping it on there. And I think for someone to figure out how to do what we're doing before we were able to protect it and deploy it. So I think that's the biggest concern. But we definitely have a lead because we've been approaching and working on psychiatry the old-fashioned way for years. It keeps me up a little bit, but not too bad. I think there's room for more than one success in the space, but we have a great model. We can scale up profitably. We really, we've kind of figured out a lot of things that we've developed wisdom and figured things out over the years. So I'm very confident in terms of our place in behavioral health, but I think AI, because it's so, I don't know how often, you use it, or that, people,
all day,
you
all
know,
day, every day,
and it
all
and
day. Yeah,
and it's surprising, like, it's always doing something new that you're like, "I can't believe that this is, just technology, that there's not another
yeah,
person on the other side doing
I
something."
know.
'Cause so I think that's the part that's like, "Oh my god,"
Yeah,
like, the world is changing right in front of our
yeah.
eyes.
Yeah, I was actually just talking to my wife because her and I work together. We've been doing this 10 plus years, and we just crossed this milestone that I read about it sometimes on the old LinkedIn post, but I'm seeing it now where I'm like, I'm so mad when AI is not doing this thing that I'm like, it should definitely do this. Right. And I'm like, why can it not go between four browsers and then push everything? Like, why can it not do that? And then I'm like,
Exactly.
yeah, AI sucks. And I forget about the fact that it wrote 10 articles for me and it did this and it did that. But I'm like, you know, it should go between all of my tools perfectly.
But give it 6 months or a year,
Right.
and it will.
That's that's the other part of this. The other part too, and my other question I'd have in this is as a power user myself on AI is how do you, really plan out for these things that we have no idea about. And so I'm struggling with this with like workflows, right? So I've got team members that I have to train. And the minute that hey, you got to do it these 5 ways, tomorrow, that doesn't exist anymore.
Yeah.
We don't do it like that. How do you think about that as scaling it out and having, lots of people using your tool as opposed to me and my 5 employees using it?
Yeah, I think it gets into design principles where I think the details will always change, but I think the overarching design principles are the same in terms of like a workflow, in terms of the goals. What are you trying to achieve? What are you trying to accomplish? That doesn't
Hmm.
change. Like even in medicine, we might have been doing it in a manual way. We're going to automate it now. We've automated it with technology. Now we're going to automate with AI. The core principles are the same.
Right.
So
Right.
that's what we want people to realize, is teach them at that level, and then teach them to be flexible, right? That's
Hmm.
a key personality trait. You want someone who can, bend with the wind and really adjust in real time, and they'll be fine. They'll figure it out. They'll figure out the
Hmm.
details. They just need to understand the overarching ideas.
Yeah. Well, what do your parents think about this? Would they use it? Are they looking at
Yeah,
it going, "Oh,
well,
I wish I had this,"
yeah, they're
or
both retired, and I think they're
yeah.
happy. I think clinicians who are older are happy that they don't have to face the onslaught of AI in their industry. I mean, there's a lot of job security concerns, I think, across the board.
Mm-hmm.
But I think, they're excited to see the potential of AI. To them, it's still magical. I think for anyone who's
Sure.
older, to see this
Yeah.
really unfolding is pretty wild. And I think even for people who are actively working today, like most clinicians have just started to really dive into it. It truly, it's exciting, but it's equally as scary in terms of what it means for the field of psychiatry.
We'll wrap up here on a personal note. Just when you're thinking about just being an entrepreneur and what you're diving into, how do you sort of stay positive, not get too high or too low on the day to day? So, how do you sort of just mentally go through everything and just make sure that you're, pushing forward with whatever setbacks might be coming your way?
Yeah, I think you have to know why you're doing what you're doing. And so for me, there are patients who have suffered because of mental health, and the way that the system is set up, it's set up in such a way where they might be getting a prescription, they might be getting a diagnosis, but their lives are not getting better. And I remember those cases, from my early years where I thought, hey, we could do a better job. And that's what got me to figure out how to do this better job, this better approach to psychiatry. So I believe very strongly in the mission that I'm making the world better by what we're doing.
Mm,
So even on the days that are tough, I know that that this is so important to make the world better. Giving people the option to understand how to achieve and maintain optimal brain health lets them achieve their goals, lets them achieve their purpose in life, and then it makes me a force for good in the world, and that's what's important. Important to me, important for something to pass on to the next generation is let's leave the world a little bit better than we found it. And I'm doing that. SohoMD is doing that.
mhm.
And that's why even on the darkest days, everything we're doing, all the pain, all the challenges, it's completely worth it.
Yeah, it's awesome. Well, where should we send people? If people are listening, they want to dive in and learn more, where should we send them?
Yeah, I think right now, in terms of from the investment perspective, I think it's the
Mhm.
wefunder.com/SohoMD. I think it gives the information about the company, the opportunity to really, support the mission, be part of the mission, to really bring high quality mental health to the masses.
Awesome. Well, I appreciate you taking time out of your day. For all our listeners out there, go to the show notes. I'll have links so you guys can find these really quickly. Connect, reach out. Really love your mission. I love what you're doing. This is an amazing project, and I hope everybody out there has a chance to go over to WeFunder and check it out. Again, thank you so much for your time. This is a great conversation.
Thank you so much, Jeff. Really appreciate it.
Thanks.